When a patient presents to me for egg freezing, we do a blood test, the AMH E2 FSH levels, to see what their ovarian reserve is, and we do an ultrasound to check how many antral follicles they have. That gives me an idea of how many potential eggs they would get and how many eggs they would have for the future. Depending on how many babies they have, we talk about how many procedures should they do so that they could get, let's say, 2 babies in the future. So for example, if somebody presents and they're 35 years old and they have 16 follicles, which each follicle is represented here by these chocolate eggs. From these follicles, we're not probably going to get 16 eggs because sometimes some of them are empty. So some of the follicles, when we do an egg retrieval procedure, go away. And so now we're left with 12 chocolate eggs, or in this case, real human eggs. When we do the process of egg retrieval, let's say we have removed 12 eggs. From those eggs, not all of them are going to be mature eggs, so we lose 2 more eggs at that point. So the next day when we look again, sometimes we do try to grow them overnight. Most of the time, if they're immature, they're not going to grow. So when a patient starts out with 12 eggs, they might only have 10 mature eggs that are then able to be frozen. From those, when we put in the freezer, we like to freeze M1 or M2 eggs. And so the more mature eggs, the better the chance of having a baby in the future. When we unfreeze the eggs in the future, not all of them are going to survive the unfreezing process or the thaw procedure. And so we might lose more by unfreezing them. And that's the day of the egg thaw. When they're thawed in the future, we then fertilize them with sperm, and so we put 1 sperm per egg, and we do a process called intracytoplasmic sperm injection, where we inject the sperm directly into the eggs. So during that process, not all of them fertilize, so we lose a few more. And so by the time we grow them to day 3, we might lose another one. And by the time we grow them to day 5, we might lose another egg. And so when we send them to genetic testing at that point, if they decide to do PGTA or genetic testing, if somebody's 35, half of their eggs are going to be abnormal. So unfortunately, the green eggs, which is abnormal, goes away. And so they're left with 1 potential girl embryo at the time. Now they could be lucky and they might get 2 normal embryos from those 14 initial eggs, or they might be super unlucky and just have 2 abnormal eggs. A lot of my patients ask me, how many eggs do I need for future babies? Again, it depends on the patient's age, but let's say somebody is 35. I usually recommend 14 eggs for 1 baby. Because of the process of unfreezing them and making them into embryos, you need about 14 eggs for 1 baby, or 14 eggs would translate to 2 embryos, which would then lead to 1 baby.